Dr. David Perlmutter, uh, you're head of the Washington University Medical School, and there's been some very exciting developments on some research and development that WashU's been doing, and I just wanted to get an update. We're going to talk about three things today, I believe. We're going to talk about a mouse model. We're going to talk about a test to see if you've got SARS-CoV-2, and then a potential vaccine candidate. So in order, why do we need a mouse model? And what's so important about having a mouse that can catch a cold?
That is essential for us to test the vaccine candidates.
And how many mouse models are there in the world right now that can do this?
Very few. So there are very few small animal models, and also there are very few large animals which are non-human primates. So this is a very important commodity.
Okay.
So a lot of the vaccine work is going on without an animal model. And that means that it's possible, it makes it more of a crapshoot as to whether or not it'll work in a human. So if you can first go into an animal model, the likelihood of having an effective and safe vaccine is enhanced.
So I know we're testing a vaccine that you've helped develop on the mice. Is there anyone else using our mice right now to help test their vaccines?
So far, no. Those mice are freely available to all investigators around the world. But so far, most of the work with our mouse model. I think there's one other at Yale, and there's one in China. But and that mouse model has been used to test two vaccine candidates here. One of the vaccine candidates here uses what's called an adenovirus vector. That's very similar to the approach being used by Oxford that you've read about in the newspaper.
And CanSino's also doing an adenovirus vector, right?
Which one is that?
The Chinese company, they're also using?
Chinese company and Johnson & Johnson. All three of those efforts are based on an adenovirus. And one of the unique things about that candidate that comes from work by Mike Diamond and David Curiel here at WashU is that they were able to administer it nasally, a single nasal inoculation. And that resulted in sterile immunity. And in particular, there appears to be a very robust secretory immune response, meaning an immune response that comes from the surface of the airways. So
could you explain to a layman why that's super important in disease transmission?
Because it looks like this virus particularly affects the cells on the mucosal surface. That's what's causing this lung disease. And so there are two parts to the uniqueness of the nasal inoculation. First, it has some appeal for people who don't like getting an injection. So from an administration point of view. And secondly, it appears because it's delivered right on the surface of the nose, which is part of the airway. It's eliciting a very powerful response at the surface, and we haven't seen that described so far in the other efforts that are underway.
So are you talking, David, now about the vaccine that was developed at Washington University, or on these other vaccines? Okay,
I'm comparing the WashU to the ones that we've learned about that include Oxford, the Chinese company, and Johnson & Johnson.
Okay, so let's talk about the WashU vaccine. So just for context here, I was approached by you and a bunch of other people about 2 months ago to provide some private funding so that you could get started even before the government was willing to fund
Right,
some of this research.
right,
So with private money from some of us, and then basically using the resources of the medical school and BJC
correct.
Healthcare, you were able to stand up a pretty robust response to the coronavirus early. And buying in a couple extra months may have given us a shorter time horizon to an ultimate treatment. So let's go to the big thing. There was a vaccine candidate that you talked about. This was 2 weeks ago, and things were very promising, but we were waiting for the FDA approval. It had done very, very well in the mouse model. It had done, I think, exceptionally well in primate studies, and that's the last I heard of it. So I'm super eager to hear the update from the last 2 weeks.
Yeah, so the, uh, let me just correct a little part of your recollection of that. We have two vaccine candidates that have been developed here, and they're different strategies. And fundamentally, we believe there needs to be different strategies. I think actually Bill Gates has described there needing to be 7 different approaches used around the world to solve the problem.
Anything
And
magic about the number 7, or is
part,
that
I don't know how he came up with that. He's talked about it a lot. One of the things to realize is each one of these efforts, in order to get a vaccine to be able to deliver to many people, is going to require a minimum of $1 billion. And so one of the most important things that we are engaged in right now, who's going to be our industry partner who can work in an environment in which $1 billion can be invested in the effort. So one of the things about, pardon?
yeah,
And
invested and potentially lost? In other words, you spend the billion and then you find out later if you've got a success.
well, I mean, that's not exactly true. I think it's by the end of the effort you've put $1 billion in.
Okay.
You will know progressively during the effort whether or not you're going to be successful. So
About how much would you have to lose? Could you potentially lose if you just said, "Look, I'll
several hundred million, yeah, several
okay,
hundred million, and
$300
and
million."
this is going to require governments, and it's going to require industry, and so that's ongoing. I mean, that we read in the paper that that's all ongoing.
Okay,
And
so you've got two candidates with different mechanisms of action.
correct, different strategies. The one that I talked about so far, the adenovirus vector developed by Diamond and Curiel, that has moved into an agreement with an industry partner from India that gives us the capability of manufacturing, doing the clinical trials, and then distributing vaccine. And that agreement is just at it's now at its final stages. And so that effort, the ramping up of that and the clinical trials of that will begin shortly. The second vaccine candidate uses a different kind of a viral vector. That one is called VSV. And it's famous because it was the vector that was used for the successful Ebola vaccine. And that was manufactured and distributed by Merck. Which, and one of the things to mention to the audience, Jim, is that it appears, as we've begun to understand all the requirements here, that this kind of investment only occurs with a multinational, very large vaccine maker. and Merck is one of them. Johnson and Johnson is one of them. The company that's working with Oxford is AstraZeneca. And the company that we have in India is also one of them. The name of that company is Bharat Bioscience. So, so the second vector, which has been developed by Sean Whalen, that is in the VSV vector, and that has also had remarkable results. Those results are in the mouse model, and that is now in the midst of its testing in non-human primates. We don't have the results yet.
How long until those results come in?
Another 2 weeks.
Okay. And have you gotten the approvals you needed from the FDA? Because I know there were some things.
No,
waiting.
the FDA part is on the testing, and
Okay.
I'll tell you about that in a moment. But this one, this vaccine candidate, we believe has a role because it's relatively easy to make to produce the VSV vector, number one, and number two, it is known to be safe in humans.
So we know it's safe, and we know we can make enough. And I remember Sean talking about the potential for making enough, basically to inoculate the entire planet. Logistics aside, but it's not unreasonable to formulate a big enough vat of this that you could have, 8 billion doses.
The only downside of the VSV, and so, this is the whole thing about having multiple strategies and multiple approaches. And the downside of the VSV is that it has to be kept at -80. So whether or not it is as good for underdeveloped countries will be a question.
So if we have a bunch of liquid nitrogen, we can transport it around developed countries, and that might not work in some very primitive areas, but that's another problem to solve. But it does look very promising.
Correct. And what you witnessed was the scientists saying they were amazed at how quickly we could get to the point that we were at.
And I want to talk about this for a second, because we've had several meetings with these scientists, and on the first 2 meetings, they were very, I would say, scientific, measured in what they said, extremely precise in their wording, didn't use any language that would be, they weren't embellishing at all. The third meeting, when they actually saw some of the early results, I would describe the air as giddy, at least in the compressed bandwidth of scientists. It was a strong response in the scientists too. So, and that gave me a lot of hope, because look, the world shut down and everybody's freaked out and talking about a vaccine, but of course there have been no great candidates. And I think one of the important messages is that WashU has one, if not two, potentially great candidates that both use different attack vectors. And that just sounded super promising. Have there been any setbacks in the last 2 weeks?
No. And in fact, over the last 2 weeks, what I've heard is this data, at least with the one vector, that relates to what happens at the surface, and that's very encouraging. And it's not something that we've heard about the other efforts that are ongoing. So I think the big news, Jim, is even if our 2 candidates don't end up in a situation where they are necessarily the thing that helps us solve the problem around the globe, the point is that we see that these approaches have promise. So if the Oxford one or the J&J one or the Chinese one or all of the above are as good as what we've seen, then we have hope for our society.
That's fantastic news. So how come we haven't heard WashU's name in any of the press? Because I read the press all the time, and I
Right.
see Oxford, and I see.
Well, most of the press at this point is about these big efforts that have been hooked up to a multinational pharmaceutical company. And I wish I could have had you on a conversation I had with the Gates Foundation earlier this week, because I was getting advice from
You
them.
just call me. If I see David Perlmutter on the phone, I will answer in the middle of anything. So
But
just in the future, if you ever, no,
yeah,
seriously, you're halfway through a call, you think, I want Jim. Look, I mean, what else am I doing?
yeah, yes.
Yeah.
Well, the Gates Foundation, of course, has played a role as a connector and a funder of these efforts. And what they said to me is, their advice to me on our two candidates was, you must have an industry partner. They suggested who were the right ones. And and they talked about how these efforts require this major investment way beyond what you would imagine. And um, and so the ones that you have seen talked about up till now, all are ones in which there is a multinational industry partner which has been engaged.
So,
Oxford, of course, with AstraZeneca, Johnson and Johnson, and the Chinese company.
so is Merck partnering with WashU on the VSV?
Not yet. They announced a partnership with an institute that also works in the VSV, and that wasn't in many ways an announcement that Merck was going to get in the game, and their strategy was going to be with the VSV vector. We think that Merck will be an excellent candidate for Sean's candidate, and they are in discussions. We think the next stage of that will be when we have the non-human primate data.
Okay. So as long as we have some healthy monkeys, we then potentially have a partnership with Merck, which is the 800-pound gorilla.
Yeah.
Okay. Got it. And this is all super exciting. Assuming Merck comes on board, assuming there is a more success in the lab, when do we start getting our nasal spray?
that's the $1 billion question. Yeah, I don't know. Remember, we have to go through clinical trials, and then the biggest leap, which you've begun reading about in the newspaper, is how do you produce it? How do you produce it to scale? How long does that take? So I don't know the answer, Jim. I think I want to say that people who say there's going to be enough vaccine to start doing major efforts by the end of this year are very unlikely, in my opinion. So
Okay.
I think we're talking about sometime in 2021 as our best hope.
Okay. So basically, we're going to have to get through the fall and winter with no vaccine.
Yeah.
And that's from the scientists and the people who know this.
Yeah.
So you're hearing other dates from people who don't actually have to live up to those dates, but the people who actually have to meet those deadlines are saying 2021 at the earliest.
Yeah.
Okay, that seems reasonable. So the other thing that will help our society get back online is testing, and you've got some very promising results in testing. Again, results that I think are super exciting and I don't read about anywhere. So is WashU holding this information? Did you
Yeah.
like?
Well, the information.
The PR department, or what happened?
Two types of tests that we've developed. Both are based on saliva, so you don't have to use an nasopharyngeal swab. And of course, the problem with the swabs, they're in short supply. They're painful and they're in short supply. But so the team at the McDonald Genome Institute has developed the ability to detect the virus in saliva. And it turns out it's a much more sensitive way to detect the virus. And they've developed two types of tests. One is a test that can do thousands of samples per day, and one is a test that could be in a device, a small device at home or at point of care in an office or in a business. The device which I call the test that I call high capacity, that has been publicized. That's a collaboration with a company named Fluidigm,
Yeah, I saw that.
which creates these microfluidic devices. They've been used mostly for gene sequencing, but here they're being used to detect virus. And the innovation here is you can use saliva, number one. It's very sensitive, and the results can be reported out in hours. So it's not the most rapid, but it's more rapid than waiting 7 to 10 days.
And in your last
And
testing, I heard that you tested 40 people and you had no false positives and no false negatives. Is that
correct,
still, you're still batting
correct.
1,000 on this?
And then we did a pilot of 600 Washington University employees anonymously, and we got great performance. We were able to process the 600 samples in 24 hours. And now we're in a phase where we're going to do a high volume of samples for our employees in a non-anonymous way, with results being reported out and being paired to the gold standard PCR assay. So we've got one stage left to go before we are ready to put that out there. It has the capacity to do anywhere from 10 to 50,000 samples per day, and just depends on how many of the devices you microfluidic devices.
Well, wait a second.
Run.
If you're limited by devices, why is the upper bound 50,000?
Yeah, I mean, it could be more. I agree. It could be
limited
more.
by the devices,
And
and
the state believes it could be
5,000
more.
a day, about, right?
Yeah, per device.
Running 3
Correct.
shifts, you get about 2,000 samples in an 8-hour shift. So some time for downtime, you're getting about 5,000 tests a day per device.
You got it.
And you have one of these devices now, or did you order the other ones?
We ordered a bunch of them.
Okay.
I don't know how many yet, Jim.
So St. Louis is going to have the ability to do massive
Yes.
testing, which will allow its colleges, allow institutions to reopen. So St. Louis may be able, even without a vaccine, to reopen.
Yes.
So let's talk about the sensitivity of this test. One of the things we've heard about the virus is that it's so dangerous because you can be infected and infectious, which means you're spreading the disease without knowing it.
Right.
If, let's say I catch the bug and I don't know it on day 1, and then on day 2, I spit into one of your test cups and you give me the result on day 3, will it tell me if I'm positive and infectious?
Right. So far, it looks like this system is a little more sensitive than the one being used, the one being used clinically by most providers, which involves the NP swab and processing. I think the limit that I've heard about most recently, as they have been perfecting this, is something in the neighborhood of 5 virus particles per microliter of spit, of saliva.
So 5 per microliter. That if I have 5 per microliter, then am I infected yet, or am I just so low that
you are by definition? If any virus is detectable, you are by definition infected. And you're right. This may be able to detect people earlier in the evolution of the infection.
Because that's what we want, like if you could sit there and say, well, look, instead of having to wait 2 weeks to find out if you have this thing, you have to wait 24 hours, then whole industries could open up. But you don't know.
And this is also interesting for your audience. The testing that has been done in this country so far is predominantly with symptomatic patients.
Yeah.
It's not been used as a it's not been used in a screening way. And so what we're moving to is capacity to develop screening that will help us to be safer in opening up the economy.
Okay, so just doing some simple math, how many of these testing machines have you got on order?
Yeah, I don't know the answer, Jim. I don't know. And what
They're
we are
complicated.
working with the state of Missouri, and what we've said to the state of Missouri is that we will help you to, we will train you to run these devices.
Okay.
So that we are planning to provide services, but we are also going to hopefully have the state provide services as well.
Now, I understand that Washington University is planning to open its campus in a controlled way in the fall, using this method of testing the students. So in the fall, we will know, because I assume some of those students will be asymptomatic and infected, and this test will either detect them or not detect them, and we might even have better news in a couple of months.
Yes. And that's our goal. I mean, our goal is to try to open up our campus in as safe a way possible, both for, all of our faculty and our staff, and the students, but also for the community in which we live. So this is part of in many ways, the wonderful thing about this is the university using its intellectual assets and its enormous research capacity to very immediately help the community in this situation.
We're so lucky in St. Louis to have an institution like WashU and BJC as a partner. I don't think people understand. St. Louis has absolute world-class medical education and healthcare. And with a virus like this, the ability to have a phenomenal hospital system that allows you to see patients and see what's going on in the real world, coupled with a research facility that allows you to quickly come up with potential treatments. And then, not to mention some little mice that can help you test those treatments very quickly. It's a fantastic and very encouraging thing. And I was always a little bummed out that it wasn't getting more press. Not that many people are going to listen to me, but I'm hoping that the word gets out, because this is incredibly hopeful. So Dr. Perlmutter, thank you very much.
Thank you, Jim.
Ask one last question, and that is, when you're in public, do you wear a mask?
I do, absolutely.
So do I.
So I'm sitting in my office. This is the only place where I don't have a mask on.
Very good. Dr. Perlmutter, thank you so much, and for all the work
Jim.
you're doing. This is wonderful.
Great to be with you.
Thanks. Bye-bye.